Now, we told you earlier how Governor DeWine today recommended that everyone still working have their temperatures taken before they enter their place of business. If the temperature is high, send them home. First News reporter Jacob Thompson this evening talked with the doctor about best practices and what employers should look for.
From a public health standpoint, I think that's a great idea. It's just another step to try to decrease the spread of this virus.
Having your boss take your temperature might sound a little weird, but it could help in a long way.
They're having any of the symptoms of this virus. It is fever, it is cough, congestion, maybe not acting like themselves.
The CDC defines a fever as 100.4. And just because your employee might have a high fever doesn't necessarily mean they have COVID-19.
We're still in influenza and flu season. I have people with sinus infections. It could be a sign of any type of infections.
Dr. Mike Zavella took my temperature to give an example, but to do so, we had to stand within 6 feet of each other, which makes it hard to have social distancing.
You're going to have to, touch the person in some way, the instrument that is going to measure the temperature. As far as I know, that there isn't a way to do that.
But you're still going to want to keep yourself and the device clean.
Make sure anything is cleaned down, between people. You can use any kind of cleaning agent.
And no matter which device you choose, Dr. Zavella says one is not better than another.
As long as you're able to get the right temperature and the right reading, then that's going to be the one that you're going to have to go with.
Now, we did speak to one member of Hometown Pharmacy who tells me there is a thermometer shortage. In Salem, Jacob Thompson, WKBN 27 First News.